We want to welcome our business partners. We want to welcome our guests, our physicians, our pharmacists, our chiropractors, our dentists, our nurses, our nurse practitioners, all of our healthcare providers. Welcome, welcome, welcome to our webinar. I'm Dr. Rita McGuire, and we're going to get it started here this evening. I'm here also with Dr. Joyce Smith. You will meet her a little later. But we're excited because this is more of a educational platform for healthcare professionals. And we believe that healthcare professionals really need to understand the information we're going to be sharing each and every Tuesday night. So I am going to start to share my screen here and tell you a little bit about myself. I'm an obstetrician gynecologist of over 30 years. I can't even believe it. I trained, did my medical school at Wayne State School of Medicine in Detroit, Michigan in the early 1990s. I completed my residency at Cook County Hospital. It's now called Stroger. I'm also CEO of RJM Wellness and Ripped Reader Fitness. I'm a global speaker on women's health and fitness. I'm also a certifying physician for the medical marijuana program here in Illinois, as well as the opioid exchange program here in Illinois. I'm a member of Doctors for Cannabis Regulation and also the chief medical officer and one of the co-founders of Wakana for Life, one of the only minority female co-founded CBD companies here in Illinois. So let's first start about really understanding the difference between CBD or hemp versus marijuana. That's always a question that my colleagues ask me. They're like, what is the difference between CBD and medical marijuana? Well, it's important to understand that when you talk about cannabis, when you talk about the constituents that the cannabis plant produces, either on the hemp side or the marijuana side, it doesn't require you as a healthcare professional to write a prescription. That's number one. A lot of healthcare professionals are really afraid of even talking about cannabis or bringing it up in the office because they feel that it's going to affect their license. And what you need to understand is that even as a certifying physician, like myself, it does not require me to use my DEA number or even my medical license to allow a patient to use either hemp or marijuana. So in order to use CBD, medical marijuana, you don't need to write a prescription. Now, on the medical marijuana side, for those who are looking for a medical card, all you need to do is check off a couple of boxes stating that this patient has a qualifying condition like rheumatoid arthritis or seizure disorder or cancer or fibromyalgia or lupus. There are over 42 qualifying conditions in the state of Illinois that a patient can get a medical marijuana card. You don't need your prescription pad to do that. The same holds true for CBD. CBD that is coming from the hemp plant, you don't need to write a prescription for your patient. All they need to know is that you understand that there is the health component with the hemp side without the high. And again, all you need is a quality product that you can refer that patient to use for their condition. So again, both hemp and marijuana, yes, they both come from the cannabis plant, but the difference is something you need to understand. See, the hemp species of the cannabis plant doesn't get you high. And the reason why is that the amount of THC or delta 9 tetrahydrocannabinol is 0.3% or less. that percentage is so low, it's such a small amount that it does not cause a high. It does not cause psychoactive effects in the body. Then on the other part of the plant, which is the marijuana species, that's the part of the plant that gets you high. When patients talk about getting certified for a medical marijuana card, well, that means that they're going to get a product that's going to have a high percentage of delta-9 tetrahydrocannabinol that will cause a psychoactive effect. And that's why so many patients are looking for a high quality, reputable CBD product that they can take, because they honestly want the health benefits without the high. So that's the difference between hemp and marijuana, both coming from the same family, which is called cannabis, but both having two totally different makeups of what we call compounds, cannabinoids, like CBD and THC. So again, marijuana has high levels of THC and low levels of CBD, and hemp has very small amounts of THC and high levels of CBD or cannabidiol. So when we talk about cannabidiol, there is one medication. Yes, the FDA has approved one prescribed medication called Epidiolex. Epidiolex is a medication that is manufactured by GW Pharmaceuticals. Many of you have heard of GW Pharmaceuticals. And this is a CBD prescription that has been approved by the FDA to treat seizures in children, to treat Lennox-Gastaut syndrome, Dravet syndrome, and tuberous sclerosis complex. This is a medication that is used in patients that are 1 year of age and older. So this is the only FDA-approved cannabis product. It is a synthetic product, which means they took the plant and they started to alter it in the lab, and it has a lot of synthetic properties. Okay, so with that being said, it's very important to know that yes, pharmaceutical companies understand the benefits of cannabis. They understand the benefits of CBD, specifically in children with seizure disorders. But they took it a step further and genetically modified it, made it a synthetic product, which again, many pharmaceutical companies, have done with herbal products. So let's talk about the science. Let's talk about how cannabis works in the body, right? Because the science is not taught to us in medical school. The science was discovered in the early 1990s. Funny enough, when I was at Wayne State School of Medicine, when I was a medical student. And this science is called the human endocannabinoid system. This is a biological system that is very vital. In fact, they have noticed that this system modulates and regulates balance in our body. In fact, it has been found that this system is in every vertebrae. It's even in some invertebrates. So most animals that have a spinal cord has a human endocannabinoid system. It's made up of receptors, and it's made up of endogenous cannabinoids. Those are compounds that our body produces, just like the cannabis plant produces. And these receptors, as you can see in the diagram, these receptors are found throughout our entire body. They're found in our brain, our central nervous system, our heart, our lungs, our liver, our kidney, our reproductive tract, our testes, our uterus, our ovaries. They're found in our immune system. They're found in our periphery. It's just fascinating how this system is vital. It regulates our mood, our sleep, our appetite, our blood pressure, our cholesterol level, our sugar level. And as you can see, specific receptors are found in specific organs and glands in our body. And that's why when you consume cannabis, it can do so many things. It can have so many medicinal benefits that involve every single organ and gland in our body. And so when we hear about CBD from our patients, when we see CBD in so many different arenas, like gas stations and stores, or maybe on Amazon, it's really marketed like a snake oil because of so many things that it can address. But now you understand that there is a science. The science has been around for decades, and this science is called the human endocannabinoid system. So let's look at some of the endogenous cannabinoids. Endogenous means that our body manufactures or internally produces these cannabis-like products, just like the cannabis plant does. So the two main endogenous cannabinoids are called anandamide and 2-AG. The plant produces things like CBD and THC and all of the other 120 compounds that the plant produces. But anandamide and 2-AG is what our body produces to keep us in balance. And with all of the external factors that are now going on with the global pandemic, with the Western diet, with the stress level that we're under, with environmental poisons and toxins in the air, many of us walk around with very, very low endocannabinoids. So our bodies are not able to produce enough because of those reasons. And sometimes our bodies are not able to produce enough because of inflammation, because of enzymes that can break down these endocannabinoids. So when that happens, we have a deficiency. When that happens, we have a lot of stress, anxiety, we can't sleep. We have high blood sugars, high blood pressures. We have a lot of inflammation going around in our body. We need these endogenous cannabinoids to reduce all of those issues, to reduce pain, to reduce inflammation, to reduce anxiety. So when we look at this system, it is a neurotransmitter system. We learned in medical school the presynaptic and postsynaptic areas. And when we look at the endocannabinoid system, it's a retrograde system. So actually the receptors bind to the cannabinoids in the postsynaptic area first, and then send messages retrograde to the presynaptic area. And so as you consume cannabis, these receptors are looking for cannabis. They lock on to those receptors and they send signals. They send signals to the brain. If you have issues with seizure disorder or issues with anxiety and depression, they'll send signals to the immune system. If you have autoimmune conditions going on like lupus and fibromyalgia. So this system is very fascinating. And again, the main parts of the brain, like the amygdala, the hypothalamus, the spinal cord, all of these major players in the brain, as you can see on the right, are important for memory. That's why those who consume cannabis and they consume it early in stages of early dementia see improvement. They see improvement in their memory. They see improvement in reducing anxiety and irritability. So the science is there. It's proven, it's shown, not only in the brain and central nervous system, but other important organs like the lungs, the liver, the pancreas, the spleen, the bones. Again, when these receptors are activated, they send signals to different parts of the body to help with appetite, to help with our metabolism, to help with our cholesterol, to help with all of the issues that we can see in many, many patients that we treat each and every day, and really not getting ahead of the game with traditional pharmaceutical medicine. So the science is the endocannabinoid system. And as it relates to my field of medicine in OB-GYN, some of the most profound studies are done showing that receptors are found in the uterus. In fact, the endocannabinoid system has a very, very important part in regulating fertility and reproduction, in helping women that have implantation issues with having recurrent miscarriages. What they found in studies was that those women have a deficiency in anandamide, one of the endogenous cannabinoids that are important in successful implantation and reproduction. So when you have a woman that has low or deficient anandamide, studies have shown that consuming cannabis, consuming CBD, consuming the plant helps to improve implantation. So I want to thank you for listening to the first part, which is the science. The science is imperative as physicians, as healthcare professionals, dentists, chiropractors, pharmacists. The science is imperative that you know that there is a endocannabinoid system discovered in the early 1990s that explains how cannabis works in the body, those receptors, those endogenous cannabinoids working together to cause on a cellular level improvement in so many conditions. Now, many of the studies that you're going to find on humans are from studies out of Israel. Israel is really the area where the science started back in the 60s, when scientists in the 60s discovered THC. Now that the part of the plant, which is the hemp part of the plant, was legalized in 2018, now you're seeing lots and lots of studies on humans that are being done at institutions like UC San Diego, et cetera. Lots of human studies are now being done using the hemp side of the plant because it is legal now. So I'm going to turn it over now to Dr. Joy Smith. She's going to bring on more information for our healthcare providers, and then we'll take some questions after she is done. Thank you so much. Dr. Joy Smith, are you out there?
I sure am. Hi, Dr. Rita. How are you? And how's everyone? 36 participants. When we first got on, it was like 5. Hey, welcome, everyone.
Welcome, welcome.
Welcome. So I am going to get on here and move it right along. Dr. Rita gave us so much great information about the endocannabinoid system, the system that we were not taught about in school, the system that we were just completely in the dark about for a while. But I am going to get into some studies and just a couple more things to talk to you about how natural alternatives to what it is that we're using are going to be very helpful for us. So one moment for me. All right, so as Dr. Rita stated, and I'll minimize that so you can see, I am Dr. Joy Smith. I'm a pharmacist in the state of Illinois. Got my doctorate from Florida A&M University, and I've had experience in outpatient, inpatient settings, ambulatory, in the clinics, and in retail. I'm also an integrative nutrition health coach, a certified aromatherapist, a member of the International Society for Cannabis Pharmacists, and I'm a Ruby dispensary owner with Wakana. So a lot of hats, but a lot of hats that really follow my plumb line of who I am and what I'm looking to do in the world. So one of the questions is, why do people seek CBD? And I want to make sure I bring up some of my notes because I had some really important things to share with you all. Why do people seek CBD? There are three main concerns: depression, anxiety, and pain. Those are the three most popular when you're talking about why people are seeking CBD. So in this study of cannabidiol, specifically CBD users, they detail the statistics about the pain, the anxiety, the depression. So chronic pain is the #1 cause of disability and disease burden globally. The anxiety disorders that people are facing is one of the most common mental illnesses in the US, and it's affecting over 40 million adults. That's so many people. And we're probably even, that number is probably higher now with COVID and everything that we have going on. Excuse me. And then in terms of depressive episodes or depression, it's estimated that 16.2 million adults in the United States, or 6.7% of American adults, have had at least one major depressive episode in a given year. So you see that CBD is really being studied for these conditions. And you see that these conditions are really plaguing our communities, plaguing our world, plaguing our nation. And the Journal of American Medical Association also had an article about how these depressive symptoms are increasing in the COVID-19 pandemic. So I'll just read this quote for you because I thought it was really important. Prevalence of depression symptoms in the US was more than 3-fold higher during COVID-19 compared with before the COVID-19 pandemic. Individuals with lower social resources, lower economic resources, and greater exposure to stressors also reported a greater burden of depression symptoms. So it's not only what's going on around us in terms of the COVID-19 pandemic, it's what's going on inside of our homes, what's going on with our finances. It's just so many things that are contributing to the depressive symptoms in this country. And so now we have natural alternatives like CBD, like essential oils, that can really address some of these conditions. And that's just music to my ears. I'm going to tell you why. So one of the reasons it just really came to me today, I was filling a prescription for lorazepam. And that medication is used for anxiety that may come along with some depressive symptoms that patients have. Excuse me. So I was filling that prescription, and every now and then I'll look at the package insert that I'm inserting into the bag for the patient and just kind of peruse it, keep my knowledge up, what have you. And so when I saw some of the side effects to the lorazepam, it literally made me roll my eyes, and it just confirmed why I am so adamant about natural alternatives to healing, natural alternatives to addressing some of these issues, still knowing that there's a place in therapy for prescription medications. I know they can be life-saving. But let me tell you what happened. So the lorazepam is designed to address the anxiety that can accompany depression, but it can also make the depression worse. So it's like, which one do you pick? What do you do? So I thank God for CBD. I thank God for essential oils, because we're able to now support these conditions and support these ailments safely and in a way that won't exacerbate other issues. So I'm just really excited about that. Now, you may be wondering, are there any drug-drug interactions between CBD and prescription medications or other plant-based oils? And in order to comprehensively answer that question, I want to dive into some mechanisms by which drugs are metabolized and how they interact with CBD. So the CYP450 system, for those of you who are unfamiliar, is a system of enzymes that are designed to break down medications and break down drugs in your body. There are over 50 different P450 enzymes, but these are the 6 most popular that are responsible for metabolizing about 90% of the drugs that we're accustomed to taking. And some of them are responsible for the breakdown of CBD in our bodies. So in terms of CBD metabolism, the quick and dirty is that CBD is a substrate of CYP2C19 and 3A4. What that means is that those enzymes are the ones that are assigned to break down CBD in our body, break it down so that it's properly used by our body and gets to the areas where it needs to go. CBD can inhibit these pathways, 2C9, 2D6, 3A4. And a lot of medications that our loved ones may be taking, even some of our medications that we're taking, are also metabolized by these particular pathways. So you may say, okay, well, do the CBD interact with my medications? Can I take it safely? What am I supposed to do? And again, there are some medications, these are some of the most popular medications that address a lot of the issues in our African American community, whether it's high cholesterol, high blood pressure, heart complications, anticoagulants or blood thinners, asthma and allergy, diabetes, some anti-inflammatories or pain medications. Now, this is not an exhaustive list, but this is a list of medications that if they are taken together at the same time, traveling down the same pathway with CBD, there could be some interaction. There can be some inhibition of some of the medications, meaning it will build up in your system. There can be some inducing of certain medications, meaning that the drug will be eliminated quicker than it should. But there is hope, because even though these medications interact, they interact when they're taken at the same time. If you're looking to take CBD safely and also continue your prescription medications, what's important is to space these medications out by about 2 to 4 hours. This way, when the medications are going through your system, they have the opportunity to be broken down, being close to elimination before your CBD is introduced, or vice versa. Maybe you're taking your CBD first and then your prescription medications later. So that is an option for you in terms of being able to not only take CBD and your medications, but being able to recommend that to your patients, recommend that to your family members, and anybody that you may be educating about the health benefits of CBD. So speaking of CBD and also speaking of essential oils, because Wakana has brought all of those things together in terms of healing without harm, in terms of having safe, natural alternatives to some medications that can be harmful. Who's using alternative medicine? You may be wondering, like, why should I care about this? Who's even using alternative medicine? Well, there are trends. You can see as the years go on, there are trends in terms of people increasing the use of botanicals, acupuncture, practices like mind-body yoga, magnetic interventions, and there's tons of other type of natural resources that people are using to heal their bodies. But you're seeing that the botanicals piece is increasing the most, and that is like the blue one, the blue bar at the bottom. The botanicals piece is increasing the most. And that's important because CBD and essential oils fall into that botanical category. And botanicals are defined as plant-derived compounds that have a medicinal or therapeutic benefit. So now that brings me to essential oils. Now, what are essential oils? Essential oils are highly concentrated aromatic extracts that are either distilled or expressed from a variety of plant material, including flowers, grasses, leaves, roots, seeds. There are all types of parts of the plant that can be broken down to produce these amazing essential oils. And also, these essential oils are used to relieve pain, like we talked about, some of the common reasons why CBD is used, to reduce stress, to improve mood. And I mean, this is just my space. I told you I'm a certified aromatherapist in addition to some of the other hats that I wear. And I'm really fascinated about how plant-based oils, CBD, how essential oils can really heal our bodies in a way that does not harm us. Now, there's a lot of complex science in terms of how essential oils work in the body with the olfactory system. And I think that this graphic really just kind of brings it home and simplifies it. So the essential oils act on an area of our brain called the limbic system. And when the aroma gets into that area of the brain, it can relax you, it can stimulate you, it can be a sedative, it can reduce some stress. It just has a lot of different functions, and those are functions that we can talk about at length outside of this call. I would love to talk to anybody about that who has questions about essential oils. But when it gets to that area of the brain, it really gets into that area that's in charge of emotion. One of the examples is when you smell a particular scent, or when you smell a meal, it may remind you of an experience that you've had. It may remind you of an old relative or anything like that. That is because aroma can bring to remembrance things that have happened in your past, experience that you have had. All of that is connected. So essential oils used in aromatherapy, there have been studies, and this one specific study, from the Asian Pacific Journal of Tropical Biomedicine, it really brings home why essential oils work. So once they're in the system, they remodulate themselves and work at the area that is needed. So at the site of malfunction, if you're having some pain or if you're having some headache, when you're using that essential oil, it gets to the source of where you need it to go. Your body is very smart. So when you introduce these botanicals, they go where they're needed. This type of therapy uses permutations and combinations to get relief from various ailments. We talked about this: anxiety, depression, indigestion, headache, and a host of other issues. And the essential oils are found to be more beneficial. Dr. Rita talks about this all the time when other aspects of life, meditation, calming yourself, making sure that you don't have any additional stress, and diet are given due consideration. See, botanicals and plant-based alternatives work best when you are feeding your body the right things. You can't expect for CBD and essential oils to work at their optimal level when you're eating fried food every day, when you're eating junk every day, consuming so much sugar. So these are options where when you're treating your body right, these alternatives, this CBD, this essential oil will come in and just really enhance all of the things that you're doing to make your body better. So some essential oil safety considerations. You don't apply them to open wounds. You want to make sure that if you do have an open wound, you either apply it around it or you just kind of wait until that wound kind of scabs over and then use it for the healing properties, maybe using a carrier oil so that you can rub it over that wound. Keeping away from the eyes and washing your hands after use. This is a personal experience for me, because what do we do? Even though I know, what do we do when something gets in our eyes? We go straight for the water. But what do we also know? Water and oil, I'll give you my face here. I don't know if you can see me. Water and oil don't mix. So if you're putting water and slapping water on your eye, the oil is just gonna sit there and it's gonna continue to burn. So what do? You make sure that if you get oil in your eye, you slap on some carrier oil, whether it's olive oil or coconut oil or grapeseed, whatever you have handy. Slap that on your eye and then you'll be fine. Patch test a small area or dilute. Now, if you've never used essential oils, you've never used a topical CBD preparation, you want to patch test an inconspicuous area, like the back of your arm, your leg, just to make sure that you don't have any reaction to any of the essential oils, that your skin isn't sensitive to it. Reading warnings and speaking with your doctor if you're pregnant or nursing under the doctor's care, have serious medical conditions, or you're on other medications. Because what do we know? Plant-based alternatives sometimes have some of the same actions as our medication. So if we're taking a plant-based alternative on top of our medication and we're not spacing it out, then there's an interaction that can occur. So 2 to 3 hour space between medications and essential oils. More is not better. These plant-derived alternatives are very, very potent. That doesn't mean that they're toxic, but a little goes a long way. They can pack a punch. So more is not better. Start off with a couple of drops and then you can increase. Or you can also use a carrier oil to make sure that you're carrying that essential oil into your body, but also to make sure that if you have any sensitivities, that those sensitivities will be lessened by having a carrier oil. If you're diffusing, diffuse up to 30 minutes at a time so you won't overwhelm your senses. Or if you're in that room where it's diffusing, step out for a minute and come back. Essential oils, CBD, they are amazing. And I feel like all of my skills have been married here because Wakana has provided both of those options for us to be able to educate and let people know how these natural alternatives can really help them in their health, in their lives, and in their daily walks. So I really appreciate being able to be on here with you all. I would love to entertain questions with Dr. Rita, and I would also love to invite you, if you want to hear about some of these products, some of these CBD products, our tinctures, our topicals, gummies, some of our essential oils, join us on our 8 o'clock call, because we will really be diving into those products, talking about how we use them, talking about all of those different things, talking about our business. We have a lot to offer here at Wakana, and we just want to make sure that you got all the knowledge that you can so that you can make an informed decision going forward. So Dr. Rita, thank you so much. I'll give it back to you.
Thank you. Thank you, Dr. Joy, so much. I want to know how many healthcare providers that we have on the line. If you could put that you are a healthcare provider in the chat box, we want to get an idea of how our business partners did with inviting healthcare professionals. So if you're a nurse, physician, chiropractor, dentist, pharmacist, nurse practitioner, wellness coach, just let us know in the chat box and we will entertain questions. We would love questions to come from our guests, from our healthcare professionals. If there are any on the line, please let us know. You can put it in the chat box there. But, you know, I want to thank you, Dr. Joy, for, you know, bringing that information, and specifically about drug-drug interaction, because as healthcare professionals, many of our patients want alternatives. And we have to be very, very cognizant of the fact that there can be drug-drug interactions with natural, organic, botanical products. And so when we do that research and our due diligence, you know, overwhelmingly, we found that many, many medications can be safely taken with CBD. Again, as Dr. Joy Smith said, making sure you're spacing your patients, their medications with CBD and essential oils 2 to 4 hours apart. There are some medications that require further, closer monitoring. You know, like if you have patients that are on blood thinners, like warfarin or Coumadin, if you have patients that are on medications like theophylline for asthma, you want to monitor those patients a little closer. It doesn't mean that your patient can't use CBD. It just means that you need to monitor those blood levels a little closer. So you will find that as a healthcare provider, that many, many patients that you have are already taking CBD. Many patients are afraid to tell you they're taking CBD, but you want to make sure that when patients are taking alternatives, that those alternatives are safe, that they're tested, and that they are from a reputable company. And that's really, really important, especially when you talk about CBD, especially when you talk about essential oils. A lot of those products can be filled with a lot of unhealthy fillers, toxins, mold, mildew, heavy metals. You know, these things can cause more harm, especially to those patients that you may have that are immunocompromised. So just know that if you want more information about specifically our product line, specifically our testing, you want to join our 8 o'clock call.